Hey everybody, I'm Priya Maseelall. I'm one of the physicians here at Pinnacle, Ohio. And I often get the question, is my lining okay? Is my lining okay? How do you determine, am I okay for that transfer? And it's kind of like the answer to the Goldilocks question. You know, is it too thin? Is it too thick? Is it just right? And I think the best way we answer is, yes, it can be too thick. Yes, it can be too thin. But what's just right is dependent on different factors. So the one factor that's the most important is, what does your uterus usually look like? And so a good doctor knows what their patient's uterus looks like and what usually is the most important. I was always taught it's not only the thickness, it's the appearance of the lining. So what we call a great lining is a trilaminar lining. I tell my patients it kind of looks like a chocolate cake. You have frosting, you have cake, you have frosting, you have cake, and you have frosting. So if I see that, or like this macaroon, I love food, so it's always something like that reminds me of what a great lining would be. If I see that pattern, we also call it trilaminar, then I'm like, okay, you're good to transfer. My lower side of thickness is usually around 6.5 millimeters. My upper limit is somewhere around 10 or 11. But when I see someone's lining and I determine if they're right for transfer, I go back, look at their other linings, see if this is the best they can do, and then I say, we're a yay or we're a nay. And that's how we determine what's a good lining.